How do we recognize evidence-based research and contrast it with fake news? Well, the first thing to do is to develop a critical mindset. Take very little at face value. Be particularly careful when things align with your preconceived opinion. We're all more willing to accept things that we agree with than things that challenge our accepted views. As far as possible, try to check the sources of a story. Be careful when it's published in somewhere that you're not familiar with, and try to follow up the references to make sure that they have been quoted correctly, because often they haven't. I think we now need to be particularly careful because images can be manipulated. Even videos can be manipulated. People can be seen to be saying things that they never did. And above all, use your common sense.
The first point that we see here is that you need to have accessibility to research. At the moment, all journals, or a lot of the journals, are based on subscriptions. If you want to read it, you have to subscribe to the journal. What we need is open access, which means the author pays for the research to be published, but the research is accessible to everyone at the moment it is being published. The second point I want to raise is the readability of the research. Researchers focus on methods, they focus on results, and then conclusions. But for policymakers, and usually a lot of other people as well, it is very difficult to understand what the methods mean, what the results exactly mean. So we need to provide a message which is clear for policymakers, which is clear for people reading the research. In our European Journal of Public Health, for instance, we ask authors to write up 2 to 3 key points. What are the lessons learned from the research? And that is a bite-sized format which can be used for policymakers.
Before providing you with a definition of knowledge translation, we first need to understand why we need knowledge translation. And it is because there is a gap between the most recent advances in research and their application. That means between what we know and what's get done. In health research, it usually takes 17 years till the first outcomes of research are implemented in practice. In public health, it can take even longer, or sometimes some outcomes of research are not implemented at all. However, when principles of knowledge translation are applied, this time can be reduced to some 3 years. So basically, knowledge translation is ensuring that stakeholders, that means policymakers or practitioners, are aware of and use most recent advances in research to inform their health and healthcare decision-making.
We've learned from evaluations that really the best way to translate evidence to policymakers is in direct face-to-face dialogue with them. It really enables a good exchange of information, not just the evidence part, but also the information about what are the implementation conditions, what is the level of policy support for this key message. And this also requires a trusting relationship between the researchers and the policymakers. So it does require some time to invest in relationship management. And then in the end, it's important to present the findings in a more coherent narrative rather than just presenting charts of figures, to also provide the policymakers with a storyline that really gains the political support they need to achieve their policies.
The main areas where we are focusing is to protect the health of the citizens, to update the health systems, and to improve the efficiency of this health system, and also modernize all the health infrastructure. In the health area, there are different kinds of competencies. The majority of them are for the member states, especially in the health systems. But there are areas where the European Union is responsible. This means specifically the cross-border health threats. So when there are threats that attack more than one country, The coordination among the member states of the European Union is also one of the competencies of the European Union. And also, we need to guarantee the quality and the safety of the different products that are used in the health system at the European level. For example, the medicines, the blood, tissues and cells, and organs.
We were very pleased to find in the New Horizon Europe several topics that relate to priority areas that we identified together with many stakeholders. 4 important areas are the focus on a healthy life, well-being, public health. A second one is investment in translational research. We really need to keep the whole chain open from discovery to innovation to new treatments. A third one, capacity building. I think especially high on the list of Europe is to address inequities. And one of the promises of Horizon Europe was to have, or is to have, a joint management of the programs under DG Santé and under DG RTD. We still have to see the implementation of that, but that would be really a step forward in the new programs.
I think the most important one has been the publication of our competency framework for public health workforce in the European region. This has been particularly a collaborative process with the ASFER, the Association of Schools of Public Health in the European region, but also many other organizations. Last but not least, I think success has been that member states have more and more recognize that coalition building is key to address complex issues, sometimes called wicked. So Slovakia, Hungary, and Georgia are all countries that have already embarked on that coalition building. So I think these are very important success stories in a maturing coalition that is by no means finished yet. But it's a very good start in the first few years of a group of people that are dedicated to this cause.
The European Public Health Week is an initiative by EUPHA that was created in 2019 with the support from the WHO Regional Office for Europe and the European Commission. And the aim is to make the case for public health across Europe, to amplify existing messages and calls to action on 5 specific public health themes that are set each year, and to encourage collaboration among public health professionals at local, national, regional, and European level.
What I really see for the public health community in the next years is an intersection between real organization, the associations in real life, just like, for example, EUPHA at the European level, and working together with online communities to bring people together, to create platforms to exchange information, expertise, to foster knowledge, and bridge a gap between the younger generations and the older ones.
EUPHA's sections are the main means of bringing together the public health experts across Europe. And the focus of EUPHA is the annual conference, which is a platform for the science. The sections work together to provide a successful conference. And there are many examples of this in terms of the pre-conferences and workshops. For example, there is a session on the implications of GDPR for public health research, which is brought collectively by sections on monitoring and reporting on public health ethics, law, health services research, and digital health. These sections are free for anyone to join, though we would, of course, encourage people to join not just EUPHA, but also the local membership organizations for the benefits that these confer.
complexity of public health has become clear to everyone, and also how public health is linked to the economy, to the environment, to technology as well, and so many other policy domains. And obviously, in combination, this is a whole range of topics that need to be covered. And we can only work in partnership, whether it's with EUPHA or other organizations, in order to make sure that all these important issues and matters are indeed covered by us.
We have been developing the EUPHA Rapid Response Team. This is a team of 40 or so public health experts that are 24/7 available to give the public health evidence and the latest evidence on an issue. We always work from an evidence-based perspective. Our aim is that through this advocacy work, we spur change and action. And actually this cycle of analysis of the scientific evidence towards advocacy and in the end action is our new EUPHA strategy for the coming 5 years.
Public health challenges have changed over the years. We face more global health challenges now, climate breakdown, international conflict, communicable diseases don't obey national boundaries, and so we need international responses to things like pandemics. And we've seen also the high levels of inequalities in health, both within countries and between countries. And these are driven by economic factors, multinational companies exploiting and causing ill health of a chronic nature. So we're facing multiple and very wide-ranging challenges that require a multidisciplinary response.
The new competencies the public health workforce really needs to have is about leadership, about communication, and about coordination, as it is so important that we learn that we need to work together with everybody involved in public health and in other sectors. And that also means we need to improve the competencies in health systems and in health policy. So we need to include much more disciplines in public health, not just the core competencies. That's, I think, is for the future really the most important thing.
We would all like to assume, or we think we're standing up for the vulnerable, and it's a very desirable goal. However, in practice, it is often not the case. And one of the reasons this is not the case is because it's not put on top of the agenda. And the question remains, how do we get this on the top of the agenda? How do we ensure that everybody works together? So in order to stand up for the vulnerable, we're going to have to tackle some of the issues that require long-term strategies. And it requires intersectoral collaboration, it requires governance, it requires people to really put this on the top of the agenda. And in order to do this, we have to really look at what strategies work and how they work at the local level, at the national level, at the European level, and at the global level.
It's become very clear in research the last couple of years that there's huge disparities when it comes to health based on sexual and gender minority status. LGBTQ individuals report higher risk for poor health and in particular mental health. So this called for more research into the determinants of these health disparities, but also to try to work to reduce these differences. And it's apparent today that the risk factors seem to exist at different levels in society, both at the structural, interpersonal, and at an individual level. So we need to work at all these levels to try to improve the life chances and health of this vulnerable group.